In this video, we are going to see about both cholinergic and adrenergic receptors and its types. So first, cholinergic receptors. It is of two types, muscarinic and nicotinic receptors. So coming to nicotinic receptors, it is of two types, NM receptors and NN receptors. NM receptors are present in neuromuscular junction. NN receptors are present in ganglion, also in adrenal medulla, which is also considered as a modified ganglion, modified sympathetic ganglion. Yeah. So coming to muscarinic receptors, it is of 5 types. So M1, M2, M3, M4 and M5. So M1 is present in enterochromaffin-like cells. So the action is it increases the gastric secretion. M2, it is present in presynaptic terminus and in heart. The action it causes are negative chronotrophic, that is, it decreases the heart rate, negative dromotrophic and minimal ionotrophic. So M3 receptors are present in exocrine glands, GI smooth muscle, pupillary sphincter, ciliary muscle, bronchial smooth muscle and urinary bladder, and the actions are it increases the secretions of the exocrine glands and it causes increased in contraction of the GI smooth muscle. In pupillary sphincter, it causes meiosis and it causes accommodation, and in bronchial smooth muscle, it causes bronchoconstriction and it results in urinary voiding. So basically the constriction occurs here. M1 is GQ, M2 is GI, M3 is GQ, M4 is GI, M5 is GQ. So these are basically G protein coupled receptors. We can remember by QI, QI, Q. Yeah. So these are the important points we should know about cholinergic receptor. Next we'll move on to the adrenergic receptors. Adrenergic receptors are of two types, alpha and beta. So in alpha we have alpha 1 and alpha 2. So alpha 1 is in turn divided into alpha 1A, 1B, 1D. So 1A is present in prostate, 1B, B for blood vessels, D for urinary bladder, yeah. And basically the action of these three are commonly contraction. Next comes the alpha 2 receptors. The alpha 2 receptors are present in fat cells, platelets, pancreatic beta cells and nerve terminals. Next, coming on to the beta 1 receptor. Beta 1 receptor is mainly present in heart and the juxtaglomerular cells. So in heart the action is positive chronotrophic, positive dromotrophic and positive ionotrophic. In juxtaglomerular cells, it causes increase in renin secretion. Next, coming to the beta 2 receptors. So the beta 2 receptors are present in bronchial smooth muscles, uterus, GI smooth muscles, blood vessels and urinary bladder. So commonly their action is relaxation. Okay. So basically it causes bronchodilation. In addition to these, beta 2 receptors are also responsible for lipolysis, tremors and release of autocoils from the mast cells. Beta 3 receptors are present in brown adipose tissue and urinary bladder. In urinary bladder, it causes relaxation. So we do have another mnemonic A, B, C, D. So A, we have to write 1, B is 2. Okay. So A, that is A alpha 1 receptors, it causes vasoconstriction. Beta 2 receptors, it causes vasodilation. In addition to alpha and beta receptors, we will also learn about the dopamine receptors. So the dopamine receptors are basically we can divide into 5, and D1 and D5 we will take it as D1 like receptors. From D2 to D4 we will take it as D2 like receptors. If we write the receptors in this order, we can easily remember the type of G protein coupled receptor using a simple mnemonic QISSI. QISSSSI. So this is a very easy mnemonic to remember the type of G protein coupled receptors in adrenergic receptors.